Okay, thank you. This time I'd open the public hearing, and before everybody rushes up, city manager, I believe, has public comment from an individual to share.
That's all right. Thank you, Mayor. I did have a submission from Bonny Specker, Dr. Bonny Specker, to be presented to the City Council meeting tonight. And I received her outline, and I'll just read her comments for the public. So this is speaking on behalf of Bonnie. I received my Ph.D. in epidemiology from the University of Cincinnati College of Medicine almost 40 years ago and have been teaching epidemiology and conducting epidemiological research since then. Every course in epidemiology I have taught, we have spent time on the 1918 influenza outbreak, just as professors and students will spend time on the COVID-19 in the future. Both the influenza of 1918 and the COVID-19 are diseases that did or will affect millions of people. In both cases, these diseases were caused by a new virus that no one had immunity against. Everyone was susceptible. There also are currently no vaccines that can protect people against the SARS-2 virus, the virus that causes COVID-19. Because of this, the only way to control the spread of COVID-19 is to use good hygiene, but also to isolate individuals who have been exposed and quarantine those who are infected. Another important method to control the spread is by limiting public gatherings. In the 1918, we were in the middle of World War, and public gatherings were not limited, leading to the spread of the virus that ended up killing 50 million people worldwide and 670,000 in the United States. The fatality rate, or the percentage of individuals with influenza who died, was about 2%, similar to the COVID-19. Although the virus causes the common cold is the coronavirus, SARS-2, the virus that causes COVID-19, is very different from those viruses. SARS-2 virus, along with the SARS and MERS virus, affect the lower respiratory tract rather than the upper respiratory tract, making them more fatal than the common cold. This is a disease that spreads quickly and is much more fatal than the common cold or the flu. It is estimated that every person who develops COVID-19 will spread the disease to 2 or 3 additional people if there are no controls in place to limit its spread. Although the SARS-2 virus is less fatal than the SARS and MERS, as shown by the lower case fatality rate, it is more easily spread and will result in a larger number of infected individuals and deaths. I gave this talk to Altrusa Service Organization in Brookings March 3rd, almost 6 weeks ago. At that time, there were slightly over 87,000 cases of COVID in about 60 countries worldwide. Today, there are almost 2 million cases in 210 countries. 6 weeks ago, we were less than 100 cases and 9 deaths in the United States. Today, there are about 600,000 cases and over 25,000 deaths resulting from COVID-19 in the United States. Although the number of newly diagnosed cases in the world and the United States are leveling off and might be starting to decrease, this is not true in South Dakota. The first case in South Dakota was reported on March 10th, 5 weeks ago. Today, 988 cases have been diagnosed in South Dakota, with over 250 cases diagnosed in the last 48 hours alone. These 988 cases are only the tip of the iceberg. Testing kits for the virus are in short supply, as are the swabs and media that are needed to test the individuals suspected of having the virus. There are definitely more cases in South Dakota than the numbers indicate. Currently, only individuals with severe symptoms are being tested. It is hard to stop the spread of the disease if you do not know who has the disease. Eventually, a high percentage of the population will be infected with this virus. The majority of those people will have either mild to no symptoms. However, about 10 to 20% will have moderate to severe disease, and a percentage of these will require ventilators to have a chance of surviving. If 1% of South Dakota population develops this disease, there will be about 1,700 severe or critical cases. If these all occur within a short period of time, the healthcare system will be overwhelmed. The most important key to minimizing deaths with this disease is to slow down the spread of the disease. This will reduce the demand on the hospitals and the infrastructure needed to support the severity of diseased individuals. Because there are so many people with undiagnosed disease, the disease can spread rapidly in a community. This has been seen in Sioux Falls, where there has been an increase of more than 600 cases in the past 10 days. South Dakota is in the early stages of this pandemic. So far, Brookings has relatively low numbers diagnosed cases, at last compared to Sioux Falls. The graph shows a cumulative number of cases in Brookings County. Community transmission is occurring, which means that the cases are being exposed to the virus in the Brookings community. Fortunately, the community transmission is currently minimal. The most important way to slow down the spread of this disease is to minimize interaction among people or to increase social distancing. The county, city, and many of the organizations within our community have done an excellent job at slowing down the spread of COVID. However, there are many additional interventions that can be instituted to slow down this disease and prevent the type of outbreak that is currently being seen in Sioux Falls. The local government needs to be able to institute interventions quickly. A matter of hours is needed, not days, definitely not weeks. Viruses don't wait for anyone.